In Britain, we also have a certain amount of alternative medicine within the National Health Service. And on the whole, it could be a lot more, and there's certainly the potential for a lot more. It's held back by the evidence-based medicine movement, because there they say, well, there aren't lots of papers in peer-reviewed journals about this, and there aren't because there aren't any grants for it, and there aren't any grants for it because the people who give the grants don't want to fund it. I'm now running a campaign in Britain to try and persuade the government to take up evidence-based medicine properly and do outcome studies. That, I think, is the fairest way. I call it level playing field trials. Take a condition like lower back pain that lots of people have, or cold sores, or something like that, or migraine headaches. And then you could have, say, 1,000 people who suffer from it. Allocate them at random to different treatment modalities. Anyone who claims to be able to cure it could try. You know, homeopaths, acupuncturists, chiropractors, craniosacral osteopaths, naturopaths, anyone who claims to be able to, acupuncturists, anyone who claims to be able to, physiotherapists, they could all have a go. And you just see general practitioners, just how they all turn out in comparison to the cost and the treatment, just simply the outcomes. Do people get equally better from all these? They might. Do people get better with some than others? Do the practitioners make a big difference? Rather, are they more important than the system? These kinds of outcome studies could, I think, actually tell us what we need to know, what works. Completely theory-free, completely pragmatic. And say it turned out that homeopathy worked best. Then, of course, the critics would say, well, that just proves they're getting a huge placebo effect. So, well, okay, if it's a big placebo effect, if they're getting a bigger placebo than anyone else, then that's the best treatment, if it's the most cost-effective. And so I went to a very interesting conference in London a few months ago on the placebo effect. And there were people from mainstream medical institutes who are now recognizing, yes, it's not just a nuisance in clinical trials, it's real, it's important, and it does something. There were other people from alternative medical research, there were skeptics and so on. But what became clear was that everyone agreed that the placebo effect, the body's own healing capacities, are important, and they're at work in all forms of medicine, including conventional medicine. The final panel discussion was the most interesting bit. It was entitled, "Can there be an honest placebo?" Because a placebo, if it's a blank pill, doesn't work if you know it's a blank pill. You have to think it's some wonder drug for it to work. So can there be an honest placebo? I thought it was a really good question.
Well, and there's a dishonest placebo out there right now that people buy by $1 billion a year called Prozac. Prozac, in a chemical test in a laboratory situation by the drug companies, revealed to be no better than a sugar pill in its effectiveness. And yet they just hid all that data, and it was hard to get it out that Irwin Kirsch, a psychologist at University of Connecticut, had to go through the Freedom of Information Act to get this data from the drug company to reveal that, in fact, it is no better than it's a good placebo, though.
Yes.
It's a good one. And you know why? Because as you said, if you take a sugar pill and you don't feel anything, then it's just your belief that's, you know, I think it's going to work. But the Prozac works really good because it has a side effect. It actually makes you tingly or something. I don't know, something like that. But the point about it, as soon as they take it, they say, oh, it's working. And as soon as they feel it, it enhances the placebo effect even farther.
Yes.
And the statistics are very clear. 1/3 minimum, 1/3 of all medical healing is directly attributable to the placebo effect, and that includes surgery as well as drug-related healing.
Yes.
So, as Rupert was mentioning, it's very important is that the drug companies are doing their level best now to identify people who react to placebos, to eliminate them from their drug so they can find a test to identify them, and then take them away from the drug test, because the placebo people ruin the drug trials, because most of the drugs are no better than the placebo effect.
Yes.